Hi, everyone. Look at what I'm wearing. It's cold and getting colder. So the cool weather has arrived and the leaves are all changing and falling off, and people are falling like crazy. This is a very early start to the respiratory virus season, and the children in our country are really the worst for wear because of it. So we have a very significant outbreak of pediatric respiratory syncytial virus disease. And since you don't want to use that term, you use the term RSV, which means it's a bad little virus that has been known for many years to cause problems for little children. It affects the lining of and their lungs and how they oxygenate, and it makes the children terribly, terribly ill. It doesn't allow them to get oxygen moving in their system very well, and they get so worn out they can't feed and then get dehydrated. This kills kids, particularly smaller children who get the disease. Why would I know about it? Well, I took care of a lot of patients with it over the years, and then 3 years ago, my new little granddaughter at 10 days of age got RSV and was very sick and in intensive care for 10 days. Her illness was treated with the same kind of treatments we're now using on adults in COVID, which is high flow nasal cannula. But you can imagine a 10-day-old pinned upright in a bed, getting this high flow oxygen setup on her face, which is taped to her face, and her struggling to breathe, getting assisted because they don't want to put the tube in the child and put them on a ventilator. That's very hard on these children also. And these little children struggling, and then you got to figure out a way to feed them, and they can't take anything in their mouth because it would go right into their lungs. And so they have to put in tubes to feed them. RSV disease in children, I just want to make you aware, is a very serious disease. And we have a very high number of cases of it going around. If you will, during the last 2.5 years, we've had very little RSV in the country and then on the planet because of the COVID lockdowns and the children just not exposed to each other, or if so, they were protected with a mask. And so they weren't spreading it to each other. Now that they're back together again, as they should be, we knew there would be a bolus, and we have talked about it on DocTalk here for the last 2 years. Whenever we got out of that COVID thing, we were going to have problems with other infectious diseases. We're there. We are there. And RSV in the kids is one of the first manifestations of it. It is really congested, I'll put it that way, the pediatric hospitals in the country. They have canceled elective surgeries. They have kept the cancer kids out of the hospital, et cetera, because they have a lot of these patients. And in some cases, it's backed pediatric patients up into community hospitals and out into places where the children aren't usually receiving care. And it's because they don't have enough beds left available in the children's hospitals. So for the emergency system, this impacts us from the 911 center through to every first responder, through every transport agency, through every community hospital, and into the children's hospitals. And it is an unpleasant thing to see a little kid struggle to breathe. And that's where we are. And like any other viruses, it is hard to treat. You have to wait for the body to defeat the viral infection. We don't have effective vaccines yet, although we are trying to come up with the right ones that serve children well against this disease we've known for a long time. So RSV and impact on children's hospitals, as well as some other respiratory viruses impacting the children. Be aware of that. Try to protect yourself. Don't send your kids out sick to go to parties or to go to school. All right. Number two, the antibiotic that we use most for respiratory infections in children is called amoxicillin. And for many of you, that's the bubblegum medicine. And nobody forgets the bubblegum medicine. It's been pink forever. It smells, and if you've had to take it, it tastes like bubblegum. Essentially, every child in this country has been on amoxicillin during some point in their life, and it's in shortage. And wouldn't you know, at the time when we have a lot of kids with illnesses, now amoxicillin is used for bacterial illnesses. antibiotics kill bacteria, not viruses, but amoxicillin is a very important antibiotic, and it is in shortage. This is just one more demonstration of how critical our supply of medicines are to our communities across many, many different avenues. And for many of the medicines that we've used for many years in the emergency system, we've had these shortages crop up. This summer, epinephrine, lidocaine, the atropine, and a number of other cardiac medicines have all been in shortage. We still have lots of shortages. Our antibiotics typically haven't been that short, but here we are with a very important one that is now in shortage. So be aware of it and understand it, because many of you have children or grandchildren and know how important it is that they get their medicine when they need it. All right, what else is going on in our world is vaccinations and discussion about vaccinations for two big things, COVID and the flu. The headlines on COVID are vaccinations are still good. And more and more and more evidence just gets layered on that COVID has prevented deaths, hospitalizations, and serious illness across normal populations and across people who have underlying bad, diseases that make them at highest risk. Personally familiar with this because having seen a lot of people go through this over the last 2.5 years, when people began to get the vaccines, we saw the acuity of the patients begin to decrease. The new variants of COVID, as you know, are getting more contagious. And unfortunately, a vaccine that is put in you does not protect you from every respiratory bug that gets on the surface of your respiratory tract. It's really hard for the antibodies to get out on the edges of your respiratory tract and your mucus. So you still can contract the disease, but when any of those viruses try to get in further into your respiratory tract, into your lungs, or out to your heart and brain and taste buds and other things, they can't get there because the antibodies are there waiting, saying, you try to get in here, there's going to be trouble. And so we have lots of people who've had low acuity illnesses, little sore throats, runny noses. This has changed since the beginning of COVID. And now most of the symptoms are superficial ones, and they're in the upper respiratory tract. And in 5 days, people are feeling better and ready to go back to work. That's a sign of really good vaccines and really good vaccine protection, is when people get a mild disease, but they don't get the invasive disease. They don't get the disease that goes to their major organs. They don't end up in hospitals. They don't end up on oxygen. They don't end up in the funeral home. And that's where we have been, and the vaccines have proven that. For those of you who've had vaccines and illness like me, I'm going this week to get my COVID booster. I'm going to get the bivalent one, and the bivalent one has more elements of the new variants, the new Omicron variants, and so far we have been protective. I am thankful that I have had my original jabs and booster, and that I had an illness in May that I told you all about, but I want additional protection. And I want it as we go into the winter time, because you never know when these variants may take off in a different direction and get more deadly. And I'm not interested in waiting to see how sick I can get. So the boosters available now. And as you know, the Novavax boosters are available in a new form because the Novavax is new. But the FDA in the last week gave emergency use authorization for the Novavax booster as well. The Pfizer and Moderna vaccines are available for kids down to the age of 5 as boosters, and my recommendation is that you get them. Finally, the next vaccine you should be thinking about and getting, frankly, in the next couple weeks, so 2 to 4 weeks, is the influenza vaccine. Why would I get the flu vaccine? Well, flu still causes bad illness. And right now, the numbers are about 2,000 patients a day in the United States are being admitted to the hospital for influenza-related illness. Flu illness is not only about respiratory tract and fever and some cases vomiting and diarrhea, but in a lot of susceptible people, it exacerbates their underlying problems. they have Crohn's disease or colitis or other GI problems, and influenza causes them to flare and for them to be very ill. That's the last couple patients I've seen and admitted with GI problems, and then they get flu and it tips them over the edge. People with underlying angina and heart disease and coronary artery problems, and they get influenza and it tips them over and they get very ill and have heart-related complications of influenza, plus the ones that just plain get the systemic illness that is influenza that you don't want. The type that is circulating right now in the United States is influenza A, mostly, and it's the H3N2 that has been a problem for the last 3 to 4 years. Best not to get it for anybody, because flu still leaves you in bed and leaves you feeling terrible, and complications of it later on are bad in other people. And at any point that you have it, you're capable of giving it to your family, your friends, or your coworkers, and that's what you don't want. So in the next 2 to 4 weeks, it's time to get your influenza vaccination. They're all a jab this year, and very importantly, it is safe for you to get COVID in one arm, flu in the other. They cannot mix the syringes together and give you one shot. They're both small volume. A lot of people say, I don't feel good for about the first 24 hours after my flu shot or after my COVID shot. And so you get them both over at about the same time. Your body is very capable of getting good results from an immunization in either shoulder at the same time. For all of you who've served in the armed forces, you know what it's like to get multiple shots at the same time, as they send you down the line and you get about 6 injections in each arm or arm and leg as you go down the line. All the way back to my dad's days of being in the Army and getting the immunizations. That's what they do. These are little bitty immunizations with a small volume, and you get them, and then your immune system gets a boost against these very important diseases. So, DocTalk this week. Children and children's respiratory diseases are in the headlines. Try to be safe with your family. Recognize it when you're in your work at Fire EMS. We're seeing sick kids, and recognize the burden right now on children's hospitals or on any hospital that serves children. We have drug shortages still important, and one of them is an antibiotic that we use in children, and it's time for vaccination. So weather getting colder, we have the opportunity to think ahead. Halloween's coming up, always a fun holiday. Little turkey time, and then Christmas and the New Year. 2023 is going to be a good year in America. I feel it coming. So take care of yourself, stay healthy. DocTalk, end of October. Take care of yourself.